Do you need clear information about Medicare? Well, the number eligible for it is skyrocketing. There are free resources available to you to get the questions you have answered.
That's right. Here to help us answer some questions is Mark Briggs. He's the CEO of United Healthcare, Medicare, and Retirement here in Nevada. It's great having you.
Good morning. Great to be here.
National Medicare Education Week. It's that time of year again.
It is.
Well, let's talk about it. What's it all about?
Well, it gives that opportunity for those that are eligible for Medicare, those that are aging in, the baby boomers, to have that chance to be able to learn more about Medicare. It really can be a confusing topic.
No question.
When is it exactly?
Well, Medicare Education Week begins on September 15th. That is timed 1 month in advance of the annual open enrollment period, which runs from October 15th through December 7th each year. That's the time beneficiaries can make changes in their plans for the following year.
And every year there's always mystery, there's always questions going into it. There's actually events locally that can help you get those questions you might have answered.
That's right. We are hosting 2 live events here in the Las Vegas Valley. The first is on Thursday, September 15th at 3 p.m. at the Revere Golf Club. And then we have another one the following day, September 16th at 9 a.m. at the Sienna Community Center.
Great. And what can people expect from these events on the 15th and 16th?
We will give a good overview of all of your Medicare options. We have had good participation at these events locally and nationally. Over 97% of the people that have attended the events in the past have said that their education and understanding of Medicare has improved by attending the event.
Well, I would hope so. So how do seniors and baby boomers participate?
Well, you can attend these live events, or there are ways to get educated year-round. MedicareMadeClear.com is a good education tool online, Medicare.gov, or you can go on and learn more specifically about the Medicare Education Week events on NMEW.com.
Yes, interesting. It's great because people have questions,
Yeah.
and we're just getting out there. There are several ways that you can get this information. Some people might prefer to come down and do it in person, but if you go online to something like National Medicare Education Week, now why was that created?
Well, we created that. There's been a lot of confusion about the Medicare program. It's a great program, but there's a lot of components to it. And we've done some surveys of those that are eligible for Medicare. About 1 in 5 find the program confusing, and about 40% of them say their understanding is fair or poor.
Oh, wow.
And so those aging into Medicare, actually their understanding is even worse. 70% say that their understanding of the program is fair or poor.
Wow. So a baby boomer, the term, I guess it considers that group of people that were born right after World War II.
Right.
And a big influx of, because, hey, war's over, hey, let's have a kid. And and we have this big influx of people that are entering now. To have this week be a month before open enrollment, it seems like by the time open enrollment's ending is when people are starting to realize what's going on. But to do it a month ahead of time kind of gets them ready to go from the first day.
We want them to be prepared and educated. There are over 56 million Medicare eligibles today, and there are over 10,000 baby boomers aging in every day.
Every day?
Every
day.
Wow.
Isn't that amazing?
Oh,
So
man.
10,000 birthdays a day.
Every day across the
baby
nation.
boomers, and then they're eligible.
That's
That's
a
a
lot.
lot of people.
That's a lot of boomers. Oh, my goodness. So there are different parts of Medicare. So this is what confuses me, because you always hear the commercials, Medicare, Part A, Part B, and all that. What does all the parts mean?
Well, there are a lot of parts to it. There are 4 primary parts. They're typically referred to as the ABCs of Medicare. So Medicare Part A covers inpatient hospital and skilled nursing.
Okay.
Part B is doctor's appointments and visits and outpatient hospital, also some preventative care. Medicare Part C is known as Medicare Advantage. That combines the benefits of Part A and B into one plan.
Oh, wow.
Often includes prescription drug coverage. Medicare Advantage plans are offered through private insurance companies, and we enroll those annually. Now, with Medicare Advantage plans, often you'll get additional benefits not available under original Medicare. Fitness, dental, vision are examples of those.
Excellent.
And then through a Medicare Advantage plan, you're able to have some of your care coordinated that can produce better outcomes and save money.
Excellent.
Then there's Medicare Part D, which is your prescription drug coverage. And finally, there are Medicare Supplement or Medigap plans, and those can cover some of the costs not covered under original Medicare.
Some things kind of fall through the cracks in these
Correct.
plans. Yeah.
Now, what should seniors do to compare their options? Like, how do you navigate A, B, C, and D?
Well, there are a lot of options that they have. Really, it's important that you evaluate those options each year. It is not a one-size-fits-all program. So each person is going to have a different fit with a different program. So it's important each year. You can ask yourself a few questions to make sure you have the best coverage for you individually. So look at your plan, look at the premium, co-pays or co-insurance, and see if that fits your budget. If your plan has a network, make sure your doctors or hospitals are included in that network. Also, does your plan offer some of those additional benefits like fitness or dental or vision that may be important to you?
Yeah.
And then finally, if you're taking prescription drugs, make sure they're in your plan's formulary and that the pharmacies they have are convenient to you.
Excellent, Mark. Some very powerful information. Busy couple months ahead of you.
Sure is.
It's great having you. Thank you so much.
Thank you.
Thank you for sharing the info.
Absolutely. If you'd like to RSVP to a free National Medicare Education Week event, you can just call the number right there on your screen. In the meantime, you can also check out the website on your screen to learn more.